Welcome back to this episode of the Hormone Café. I'm Dr. Sarah Pederson. Today we're going to talk about painful cycles because I really want to make sure that you're not having a painful cycle, and if you are, we are looking at all the different ways to manage it. So we're going to talk about what is a painful cycle. How do you know if your cycle is too painful? What are the different things that can cause a painful cycle? And then how we figure that out, and then how we treat it. So the first thing I want you to know is when you're on your period, you want to be able to function. You shouldn't be, if you are one of those people who you had to call out of school, you're curled up in a ball, your heating pad is your best friend, you're chugging ibuprofen or Tylenol or Midol during your period, those can all be signs that your period is too painful. What we consider in the range of normal is that you have no pain at all when you're not having bleeding. So if you have pain after your period, if you have pain during ovulation, if you have pain or cramping leading up to your period, all of that is not normal. When you're on your period, you should be able to function. You should be able to live your life. You shouldn't need more than 3 ibuprofens for one day. If you're having to take more ibuprofen than that, then that can be a sign that there's something going on. Sometimes we can't always get cramps to go away 100%, but the goal is to get them about 90% better, because having your period is a little bit of an inflammatory state. So it will irritate your uterus a little bit. So every once in a while, we'll need a little bit of a heating pad for like 10, 20 minutes or a couple ibuprofens, but that's within the range of normal. If you're needing more than that, then we definitely need to look into it. So let's talk about pain. What are all the different things that can be causing you to have a painful cycle? So when we think about a painful cycle, I think about 6 different things. One is just general inflammation. I know inflammation is kind of a catch-all word. However, there's a lot of inflammatory conditions that can cause pain during your cycle. For example, if you have an autoimmune disease, or another huge one is gut. So if your gut is inflamed, or you have a leaky gut, or you have a food sensitivity or a gut infection, that can cause inflammation in your uterus. I've had a patient, for example, who had such a leaky gut that there was bacteria in her uterus that's traditionally found in the gut. So your gut can be so leaky or so inflamed that it can actually cause painful periods. So that's one thing that I always recommend looking into is general body inflammation. So we can do a lab called an ANA, which stands for anti-nucleotide antibodies, to look for autoimmune issues or pre-autoimmune issues. We can do other inflammation labs, for example, something called an ESR and a CRP. And then of course, I definitely recommend having a gut health test. So inflammation can be a huge cause of pain on your period. Another cause is what I think of as the outside of your uterus. And the biggest thing that we think of on the outside of your uterus is endometriosis. Endometriosis is where the inside lining of your uterus grows on the outside of your uterus and on your ovaries and on your fallopian tubes and on your bowels. It's kind of like if you think about an orange, think about the fruit of the orange is on the inside. So imagine the fruit on the inside growing on the outside on the peel. That would look really, really bizarre, and the juice could spill out. That's why endometriosis can be so painful, is because it responds to the hormone withdrawal after your luteal phase when your period starts, and it can start bleeding and be inflamed, and that's why endometriosis can cause so much pain. So when we think about pain on the outside of your uterus, you always want to think about endometriosis. And there's different ways that we diagnose endometriosis. Oftentimes it does require surgery, but there's also a biopsy that we can do to see if you have endometriosis, because it's a huge, very, very common cause of pain during your period. And I think sometimes people don't think about having endometriosis until their period is extremely painful. For example, if they have pain radiating down their legs, pain in their hips, pain in their back, those are classic signs of endometriosis. But endometriosis can cause even just the lightest of cramps. So if you're one of those people who is having to use a lot of ibuprofen heating pad all day long for multiple days on your cycle, you definitely want to think about endometriosis. In the category of things that also could be on the outside of your uterus or kind of in your pelvis, we also think about scar tissue. Sometimes if you've had an infection, whether you knew it or not, or old endometriosis, or a previous surgery, or a ruptured appendix, or anything like that, there can be lots of reasons why you could have scar tissue on your ovaries, on your fallopian tubes, on your uterus, and sometimes that scar tissue can pull the uterus or the ovaries in one direction or the other, and that can cause a lot of pain on your period. And that usually we have to do surgery in order to diagnose, because unfortunately scar tissue usually doesn't show up on an ultrasound or a CT scan or an MRI. However, every once in a while, if you go to a visceral manipulation specialist, they can sometimes feel scar tissue inside. So it's definitely worth having a good exam to see if you might have scar tissue, if your uterus is mobile, if your ovaries are mobile, or if your organs kind of feel stuck inside your pelvis. And then another source of inflammation that can cause pain is in the walls of the uterus themselves. This is called adenomyosis. It's basically inflammation inside the walls of your uterus. That is the hardest to treat because we can't remove it. Endometriosis, we can remove. I go in, take a tiny little scissors and cut out each piece of endometriosis, but adenomyosis is very difficult because it's in the walls of the uterus, so we can't go in and take it out because otherwise we'd be hacking your poor little uterus to pieces. That one's tricky because technically, if you think about the definitive treatment of adenomyosis is to have a hysterectomy. But for those of us who want to keep our uterus, that is not a good option. So adenomyosis can be diagnosed on an ultrasound or it can be diagnosed on an MRI. So it's very helpful to have imaging. And it looks like little black dots or lakes on an ultrasound. If you have adenomyosis, we really think about chronic long-term management of inflammation to help your pain while you're on your period. The next cause of pain is inside of your uterus. So if we think about our orange analogy, there can be issues on the outside of the peel, there can be issues with the peel itself, and then there can be issues with fruit on the inside. And the inside lining of your uterus is called your endometrium. And that can be infected. So there's something called endometritis where you have an infection on the inside lining of your uterus, and that can also cause pain. That's a big deal. The cervix is another big place where you can have inflammation. Inflammation on the cervix we can see on an ultrasound, and we can also see on a biopsy. So if you have any inflammation or infection on the inside of your uterus or your cervix, and that can cause pain. And then the last area that can cause pain is your vagina. Sometimes people have dysbiosis or abnormal bacteria in their vaginal tissues that can go into the cervix, into the uterus, and cause pain. Sometimes people don't think about their vaginal health as a cause of pain, but I see a lot of vaginal infections that if we treat them, people have much, much, much better periods. So for example, if you come to me and you say, okay, I have really, really painful periods, I'm dying on my period, I can't function, I have to take tons of ibuprofen, there's lots of different things that I'm going to want to do. For example, do inflammatory blood work on you. Make sure you have a gut health test. Do a test for endometriosis or do something called a laparoscopy in the operating room where we look and see if you do have endometriosis and take it out. Check for scar tissue. Do a pelvic ultrasound. Make sure you don't have anything else that could be causing pain. For example, big cysts on your ovaries we also find, or swelling on your fallopian tubes can cause pain, or adenomyosis, so inflammation on the inside of your uterus. And then I also recommend doing a uterus biopsy, and we send that for a stain for endometritis and for cultures, and we check for white blood cells to make sure you don't have infection on the inside of your uterus. And then I also recommend doing a vaginal swab, because sometimes there can be certain bacteria that are overgrowing in your vagina that if we treat can really help with pelvic pain. So when we think about our 6 categories, we're thinking about inflammation in gut, the outside of the uterus, so endometriosis, or that could include things like ovarian cysts, swelling on your fallopian tubes, the walls of your uterus, the inside of your uterus or your endometrium, and then your cervix and your vaginal tissues. So there's all kinds of things that you want to get checked out, because I think sometimes when we think about pain on your period, a lot of times people will just instantly think of endometriosis. But every once in a while, I'll get a patient where they're coming to me, they've had endometriosis surgery and it didn't really help their pain that much, not as much as they would have thought, or it didn't help their pain at all. They had endometriosis, they had the surgery and it didn't help their pain. And then that makes me think, if the surgeon did a great job and they excised all the endometriosis, why didn't it help the person? It's because we're missing a form of inflammation. So if you have endo surgery and you're still not helped, it's because we didn't do a full workup and look at all the different causes of a painful cycle. So if we find something on that evaluation, there's lots of different treatments that we can do. I think the mainstay, of course, of everything that we do here is nutrition and sleep and stress and exercise and things like that. So for example, when we think about inflammation and being on a diet that limits inflammation, I always recommend that you be as low sugar as possible, meaning you're not adding sugar to your diet every single day. You only save treats for once or twice a week. For example, I know a lot of people want to put sugar in their coffee and have their lattes in the morning and add honey and things like that. But you only want to have latte Sunday, where you have a latte on Sunday morning. You don't want to have like latte Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday, because it's just way too much sugar every day. And that will chronically inflame your body and that will make your period worse. Another thing that we want to be doing is really leaning into our antioxidants. One of the big reasons that people can also have painful periods, or the pain in their period is exacerbated, is having low magnesium. Our magnesium foods are going to be red meat and leafy greens. So you really want to be eating a lot of leafy greens at least once a day if you can, especially if you have painful periods. And sometimes people think, ooh, I don't want to have a spinach salad or a kale salad every single day. It doesn't need to be a high volume. You can reach into your fridge, grab 3 leaves of spinach, pop them into your mouth. If you make that a routine and a habit every day, it will up your magnesium levels and it can definitely help your period pain. So we really want to be leaning into our protein. We want to be leaning into our vegetables, especially our leafy greens, and make sugar and other inflammatory foods very rare. So be really, really careful with refined and processed food. So anything in a package you want to limit to only once a week. And white or refined carbohydrates can be also inflammatory. We don't want to be doing white bread, white buns, white rice, white pasta. Everything you want to be whole grain, long grain, brown. The more ancient grain, the best. So when we think of spelt, buckwheat, rye, einkorn flour, millet, those are the kind of flours that we want to do, because those high quality grains are less inflammatory than our white bread. So when we think about just decreasing pain on the periods, you really want to start with diet. I had a patient who had a really painful period and she was eating a lot of sugar every day. She was adding honey to her coffee every morning. She was having dessert. It doesn't seem like a lot of sugar, but when you think about it, putting a lot of sugar into your diet every single day can kind of add up. And she said, Dr. P, I don't believe you. I don't think that what I'm eating is causing me to have so much period pain. And so I had her cut back her sugar levels, do black coffee or coffee with just heavy whipping cream. And then I had her save treats for once a week and do it for a month and see how she did. She came back to me and she said, oh my gosh, my period is so much better. I didn't believe you at first, but now my period is better. I can function. I have less ibuprofen. I'm not so inflamed. So some of that can be fixed just by changing what you're eating. So inflammation is huge. And then, of course, we want to be moving our bodies, because one thing that's very, very helpful is blood flow. So we want to be getting good blood flow to our uterus, good blood flow to our cervix. So we want to be doing cardio 3 times a week. It doesn't have to be for a very long period of time, 15 minutes, but enough to get our heart rate up to improve blood flow to our organs. Because if we're not getting good blood flow to our uterus, it's going to be crying when we're on our period, and that will cause the pain to be worse. Other things that we want to think about are supplements. So when we think about our anti-inflammatory supplements, 2 of my favorites are omega-3 and curcumin. Curcumin is also the spice turmeric. So if you're adding turmeric to things, making a turmeric latte, those things can be very anti-inflammatory as well. And then when we think about our other sources of inflammation, we want to be, as I talked about, focusing on our magnesium. So it can be helpful to take a magnesium supplement every single day to help with pain on our periods. So we want to be moving our body, eating a low inflammation diet. And then if we find any issues in our gut, there's lots of different gut protocols that we can use to decrease inflammation in your gut. Or for example, if we find inflammation in your body, if you have Hashimoto's, which is an autoimmune thyroid issue, if you have autoimmune issues, we can treat those. If you do have something like a cyst on your ovary, endometriosis, swollen fallopian tubes, those often need to be treated with surgery. I know nobody wants to have surgery, of course. However, it can be extremely helpful to do restorative reproductive surgery, restore your anatomy back to itself. I have so many patients who I do endometriosis surgery and they feel like they get their lives back. Or if you have adenomyosis, inflammation on the walls of your uterus, and we really focus on those inflammatory lifestyle things. If you have endometritis, so inflammation or an infection on the inside of your uterus, that we often treat with antibiotics because it's really, really hard to get to the uterus. So we can do antibiotics, probiotics, and then I always recommend after you take antibiotics, repeating a biopsy just to make sure that infection is truly gone. But I have a number of patients who I diagnose with endometritis. They take antibiotics and they say, oh my gosh, my period is so much better. I had no idea that it could be something in the inside of my uterus. No one had ever told me that before. Or I have a lot of people who have things come back when we do a vaginal swab, for example, ureaplasma, mycoplasma, prevotella, different species of yeast, Gardnerella, different species of bacterial vaginosis. And if we treat those properly with antibiotics with a mind to reconstituting the healthy vaginal microbiome, which means oftentimes doing an oral or vaginal probiotic, reconstituting your natural vaginal microbiome can actually really help with pain on your period. So there's lots of different treatment options, lots of different things that we need to look at if you're a person who's having painful cycles. So if you're one of those gals who you have to be using a lot of ibuprofen, please do not give up on your body. Advocate for yourself. Make sure you have a really excellent workup. If you want to come see us here, definitely come see me. Schedule an appointment. You can see me at verafertility.com. And thank you so much for joining us today on the Hormone Café. Our next cycle, we're going to be talking about irregular bleeding. So if you're someone who might have irregular cycles, of course, tune into that next episode. And we'll see you next time.